Hi, good morning, everyone. I'm Vicki Small, volunteer and legislative team member with AARP Indiana, based here in Evansville, Indiana. I'm very pleased to kick off the second annual event in AARP's Indiana's Longevity at Home series, a collaboration with Swerka and more that is intended to connect Hoosiers with information and resources that can better help them age in their homes and communities. I think something all of us are interested in. Today, we're going to hear from several speakers about home and community-based services, what they are, why they matter, and how they may be able to assist you or a loved one live well at home. If you're viewing this live, feel free to submit questions, and we will do our best to answer those throughout the program. Without further ado, I want to introduce the first presenter. Shelley Dunn is the Aged and Disability Resource Center Supervisor with Swerka and more, and has served in her role for nearly 8 years. The ADRC is the gateway to Swerka's many services. Prior to Swerka, Shelley worked in mental health and disability fields for combined 17 years. Welcome, Shelley.
Thank you. Thank you very much for having us. We're excited to be able to share some information about Swerka and more with the community. And unfortunately, it seems like we're the best kept secret, and we don't want to be. We want to make sure that people know that these resources are out there. So what Vicki said is I supervise the Aged and Disability Resource Center, the ADRC for short. And basically, that's the incoming calls that come into Swerka. It's the gateway to the services that we provide. So basically our mission is to let people age in place. Most people would like to stay in their own homes as long as possible, and that's what we want too. Now, sometimes they may need a little bit of assistance with their activities of daily living. So some of the things that we can help provide and to hook people up with resource-wise would be maybe an attendant to help with some of the bathing, the dressing, using the restroom, medication management, things like that. Maybe it's just some of the light housekeeping. Maybe it's home delivered meals, anything like that. We also assist people with insurance needs, like to navigate the Medicare waters as well. That's some of the things that we do. But basically, the ADRC is where those calls come in. It might be that they call in and they're asking for resource information. Maybe they just don't know what's even available out there. So we might talk about Medicaid PA providers. We may talk about some veteran services. We may talk about the Bureau of Developmental Disabilities. It's all encompassing mental health. All of those different aspects work together that we try to hook people up to make sure that they're getting the services that they need in our community. Now, what we do is we provide options for care. So our staff are called options counselors because everybody's situation is different. Now, to qualify for the Swerka services, we are Swerka, which is Southwestern Indiana Regional Council on Aging, but we're Swerka and more. And the and more is folks with disabilities. So it's not just for elderly. We have, I think the youngest person that we have on our caseload is about 8 months old. So we even serve children. So that's the and more. But what qualifies people for Swerka services is it has to be a need of assistance with an activity of daily living based on a medical need as opposed to a cognitive issue or a mental illness. So for example, if somebody can't bathe because they have neuropathy in their legs or something like that, and they can't get in and out of the tub, or they have COPD and they have that shortness of breath and they can't bend down and wash themselves, that is a qualifier. But if they're not bathing because they have depression, that would mean they would not qualify. Not to say that somebody that has depression wouldn't qualify for anything, but we have to look at the medical model because that's what our funding is for. So if somebody just strictly has some of that depression, what we do is work with some of our community partners to make sure that individual is actually receiving the services that they need, even if it isn't from us. So basically, when a call comes in, our referrals can come from any number of sources. It might be the individual calling themselves. It might be a family member. It might be a doctor's office. It might be adult protective services. It could be a home health provider calling in saying, hey, somebody needs assistance. Now, our services are voluntary, so nobody's court ordered to be here or anything like that. So if our referral comes from someone other than the individual themselves, we have to follow up with that individual, that make sure that they're in agreement to, chat with us and find out what we have to offer them. But most people are pretty interested in when we tell them what we're doing is trying to keep you in your own home and not have to go to maybe a nursing facility or anything like that. And so most people are pretty receptive to be able to assist with that. And I know I talk really fast and I can talk for hours on all our stuff. I'm very passionate about trying to keep our seniors and our community members in their homes. But we have a couple other of our staff that want to talk as well about some specific programs that we have. So I'm going to turn it back over and you can, I guess, introduce Linda next. Thank you.
Thank you. Thank you. Want to see if there are any live questions? If not, Linda Wright is the Community Transition Supervisor with Swerka and more. She's been with Swerka for 28 years. Her responsibilities include supervising a team of 10 case managers, as well as coordinating programs, including Money Follows the Person, Dementia Friends Indiana, and pre-admission screenings. She joins us today to share more information about those programs. Welcome, Linda.
Hey, Linda, you're muted. You just unmute yourself. You're fine.
Sorry about that. We're going to start. I'll start talking about the pre-admission screening program. Pre-screening is a process through which we assess persons wanting to go into a nursing facility from home. We do probably about 15 to 20 assessments for those every month. What we're doing, though, when we're assessing for nursing home is we're discussing options with them, just like Shelley said. Any assessment we do, we're talking about options. And in that, if we can provide services that would keep the person from having to go to the nursing home, that's going to be our goal. But mostly what we're doing is saying that they're appropriate or not to go into a nursing facility and offering services instead, if possible. I also supervise the Dementia Friends Indiana program. It's a grassroots movement through which we're trying to spread understanding and knowledge about dementia so that persons living with dementia and their caregivers can access our community freely. In order to do that, what we're doing is 1 hour information sessions. Right now they're being done via Zoom. So in the course of an hour, we talk about a lot of things, hints on how to deal with people with dementia, communication strategies, and those kind of things. Then at the end of that hour, the people who have gone through the information session are then dementia friends. We ask them to take some small step in order to further the movement, because it is a grassroots movement, and that can be as easy as just sharing what they've learned through the information session, telling others, helping out somebody caring for a loved one with dementia. Then the other program I supervise is called MFP, and that stands for Money Follows the Person. What the premise of that is that Medicaid pays for facilities in a nursing facility for a person, so that money should be able to follow them back into the community and pay for services at home, where we know the cost is cheaper and care is generally better and individuals are usually happier in a home setting. So we talk to persons in the nursing home, referrals, and do whatever it takes to get them out of the facility and into the community. A lot of times that's finding housing for them to even start things. We have probably about 50% of our MFP recipients go into assisted living, which is a really good option, especially for those that need at least 24-hour supervision for reasons. So we find the housing, we set up services that will make them safe in the community. And since a lot of people who go into the nursing home lose all their home furnishings and things that they need, there's a community transition fund that enables us to help them get new furniture and all the household items you need, sheets and towels and all those kind of things. It's a limited fund and there's a lifetime cap on it, but generally we can do the shopping and get everything a person needs through that. Then we follow through with the transitioning to their new home, and then provide ongoing case management to make sure that they're safe in the community then.
Okay, thank you, Linda. If there are any questions, we can try to answer those. If not, let me now welcome Michelle, and I might butcher your last name, sorry. Is it Wright?
It's Ray.
Ray, Michelle Ray is an in-home services supervisor with Swerka and More, and she's been with the organization for just over 12 years. She began her current supervisor position in 2019 after starting as an options counselor and then a team leader. During today's program, Michelle will provide an overview of the state's community and home options to institutional care for elderly and disabled programs, more commonly known as the CHOICE program. Welcome, Michelle.
Thank you. Like previously stated, do we have the slideshow going also? Sorry. Okay. So I'm going to talk about CHOICE. At Swerka, we do have several different funding sources. One of our primary funding sources is the waiver program, both the aged and disabled, money follows the person, and the traumatic brain injury. But we also have non-waiver funding. And out of our non-waiver funding, our biggest program is CHOICE. So today I'm going to give you some information about the CHOICE program. Next slide, please. CHOICE is always considered a dollars of last resort. These dollars are set up by the state legislature and the budget. And what we mean by dollars of last resort is Shelley kind of alluded to it when she was talking. We do look at all of someone's options. So we see if their needs could possibly met by the VA, through the Bureau of Developmental Disabilities, if they have private pay, what options are available to them. We really try to dig in and see, some people have a lot of doors that are open to them and some people don't. So because CHOICE is such a limited budget, we really want to try to make sure that the people that we're helping through CHOICE really don't have other options available. Let's see. When we do options counseling, we really do look at what is this person needing, and making sure that we're using the funds wisely. So next slide, please. CHOICE does serve a wide population. So Shelley kind of alluded that we are the Council on Aging, but we also focus on other groups as well. So CHOICE can serve children as well as adults. And one thing that's a little different about CHOICE versus our waiver programs is someone's needs can be based on either mental health or a developmental disability. So it is a little bit different than our waiver programs with that. Along with next slide, please. CHOICE looks at not only a variety of populations or determinations for why you're needing help, but as well as financial background. So with the waiver programs, there's a lot of financial restrictions based on qualifying for Medicaid. But with choice, someone could have a higher income or higher resources. However, with that being said, there also may be a cost share. So if someone does have higher income and higher resources, they may pay a portion of the services that are being provided to them. So, along with income and resources, we also look at deductions. So, what you're paying out in medical fees, prescriptions, if you're privately paying for services, all of those types of things are taken into account. For children, parental income is considered as well as resources. And typically, how we look at the family is whoever would be filing taxes together. So, if you have an older couple and their son lives in the home, to kind of help them out, but he would be filing his own taxes, then we would not take into consideration his income or resources. But if it's a dependent child, and you would file them on your taxes, then they are counted as well. So, um, let's see. Next slide, please. Choice can provide a variety of services. We try to make help someone be as independent as possible. So if we can provide assistive devices or one-time modification, that is always an option, as well as ongoing services. Attendant care helps primarily with personal care, bathing, dressing, those types of hands-on assistance. A home health aide is a little bit of a higher level of care. Personal emergency response buttons. Home and community assistance is more like homemaking, help with vacuuming, dusting, light housekeeping, those types of things. Home delivered meals, and more. So there's really a variety of options that are available through the Choice program. Um, we can help with like bathing chairs, grab bars, all types of equipment and different options. So next slide, please. So the level of care for this program is a little bit different than the waiver. You need to have assistance with 2 activities of daily living. So dressing, bathing, transferring, ambulating, those types of things. And again, it can be based on either mental health or a cognitive disability. So that is a little bit different. For children, typically with a waiver program, you have to have a skilled need, like a peg tube or something along those lines. But for children with choice, we look more at age versus what they should be able to do for their where they are developmentally. So if a 5-year-old isn't ambulating, that qualifies them because typically 5-year-olds are able to ambulate. But we wouldn't look at bathing for a 2-year-old because a 2-year-old needs assistance from a caregiver to bathe. So um, there was a pilot program a while back that looked at critical needs. We do look at those for short-term services or maybe a one-time modification. Those get a little trickier, but someone's always welcome to call into our resource center and we can provide some more information about that. Instrumental activities of daily living like cooking and cleaning, we do look at those, but they don't actually qualify someone for assistance. So next slide, please. And really the best way to find out about how these services impact is just to talk with people. So we've really been able to make a difference in a lot of people's lives. Some of it is by one-time modifications, doing ramps, bathroom modifications, and some of it is ongoing services. We've had a lot of people who thought they wouldn't be able to stay in their home, but we were able to put services in, and they were so happy that they could stay at home and continue to age in place instead of having to go to a nursing facility. So that's all I have. Thank you.
Thank you, Michelle. I think we may have a live question here. Mandela asks, how do I make sure my loved one can qualify for choice?
Well, what they would do is call into our Aging and Disability Resource Center, which the phone number for that is 844-664-7817. And they would speak with one of the options counselors. That options counselor would gather some information from them, and that would start the process. If they're wanting to be assessed for services, they just gather some information at that time, and then it goes out to an options counselor, and that options counselor will call and complete a full assessment with them to let them know what they're eligible for.
Thank you. Are there other questions? All right, let me introduce Addison Pollock. Addison is the Director of Community Engagement with AARP Indiana, and he has served in that role for 4 years. He's the staff liaison for the Evansville area, including work with the local volunteer team, and I can tell you we're all really happy to be able to work with him. He's joining today's program to discuss the state legislation that impacts the Choice program. Addison, welcome.
Thank you, Vicki. Thank you, Shelley, Linda, Michelle, for presenting today. I wanted to round out the program by talking about advocating for choice dollars, because right now we're in the middle of the General Assembly session. So the state legislature is meeting right now to craft the biennial budget, actually. So the timing for this program is perfect. So I wanted to touch on how you, the viewer, if you're liking what you're hearing today, how we can expand individuals' independence to live in their homes, live happily, safely, and comfortably in their homes for longer periods. We need to shore up programs such as Choice to make sure that there is funding available for the demand, and we know that the demand is growing for programs such as Choice. So next slide, please. So simply put, we need your voice, and I am talking to you, the viewer, today. Like I mentioned, this is the perfect timing to make your voice heard. If you want to make a difference, the Indiana General Assembly is meeting right now, and the state budget bill, which is House Bill 1001, actually just passed through the House of Representatives at the state level, and now it's going over to the Senate. And that will then go through the Senate Appropriations Committee, which is the committee that handles all things that have to do with taxpayer dollars and money. So basically what we're doing now is we're hoping to have folks communicate, talk to their state senators, let them know why they think programs such as Choice are so important. Just to provide a little bit of lay of the land, the way that Choice is positioned now in the state budget bill, so it's a proposed budget that is moving its way through the legislative process. It is proposed at around $44 million a year for the next couple of years. Unfortunately, this is around a $5 million reduction from what was put in the budget for 2020 in years prior. So what we're hoping to do this year is, next slide, please, is we are hoping to reinstate Choice funding to that 2020 level. So for each year in the budget bill. So we're asking for about $49 million for that fund. And it's critical because as Michelle and Linda and Shelley had touched on, home and community-based services, excuse me, there's such a demand right now, and I think that demand is only going to grow as we see that our population is aging. So it's important to communicate to our legislators, our public officials, that you might not hear about it often, but a lot of people use these programs and they're critically important. So we just want to remind our legislators that this is an important program. Next slide, please. And really, what we want you to do is, we're not asking you to be an expert in Choice funding. I'm certainly not an expert in Choice funding. That's why I had these wonderful guests on today to talk more about it. But what we're hoping to do is, as Michelle had shared with us, there are stories that people have about why this program is important, and we just want to communicate those to our state legislators, specifically our state senators. So you can share your story by calling, emailing, or writing a letter to your state legislators, just expressing, if you watch this program today, you might just want to share why you think the program's important, or if you have personal experience with the program, you might want to share a little bit of that as well. Next slide. So we're asking you to make your voice heard. What you can do if you want to, make an impact today is you can actually go to the Indiana General Assembly website, iga.in.gov, and you can, if you scroll over to the information banner there, and you click on that, there will be a drop-down menu that has a little option that you can click on to find your legislator. So if you click on that, it will take you to a screen that's shown in the next slide. This screen right here. So you can enter in your home address information, and you can figure out who your legislators are, your state legislators as well as your federal legislators. But we're really focusing on state senators when it comes to choice funding currently, because that's the group that's going to be hearing the budget bill, and they're going to be making decisions that impact the choice funding. So like I said, you can feel free if you'd like to share your support for that, or share your opinion on choice funding. We think it's really important. We think it's critical. So we just wanted to share how you might be able to voice your opinion and make your voice heard. I do want to plug, I think we have a banner for this. AARP has action alerts that you can sign up for. If you go to that web address, and I think there's also a drop-down menu where you can find your state, Indiana, you can sign up for those action alerts as well. And you'll go into our system, and we can, whenever we're working on a critical piece of legislation, might not be choice, it might be something else that's really important, you will receive an email, and you'll be prompted to take some sort of action. You can sign up or sign a petition letter or something like that. So that's another great way to get involved as well. With that, I just want to say thanks to everyone for watching today. We wanted to keep this short and sweet. We hope you got something from it. I now want to hand it back to Vicki Small to close us out.
Hi, thank you, Addison. Just want to check one more time if there are any live questions. Okay, well, thanks to all our speakers for speaking today. Every time I hear a presentation by Swerka and More, I am just so happy to know that there's an organization like that in our community. I care for my aging mother at home, and I found Swerka to be a great resource for ideas and suggestions about things we have been able to do to help her stay at home. She's 94 years old, so we're pretty happy about that. If you enjoyed today's program, you can register for the next one. And I believe, yeah, there you go, the aarp.cevent.com on Longevity 3. And if you need help, please feel free. Please do reach out to Swerka. They're there to serve you. And there's the contact information you can use for them. And the next topic is going to focus on home repair, maintenance, and safety. And it will feature Swerka and More and Catholic Charities. So thank you all. Take care and be safe out there.